Hey, it's Amber from the Training Tool, and I am currently 74 days out from my ACL reconstruction surgery. So it's about 10 and a half weeks since I had surgery. I'm actually doing very well, and I am back to doing some of my activities. I am still doing physical therapy twice a week and getting some new exercises that I'm getting to do. My knee seems to be getting a little bit stronger, still a little stiff. It doesn't like to go all the way straight, but I have to say that my pain level has gone down tremendously. I very rarely have just little inklings of pain here and there. It does pop a lot, which in the beginning was pretty scary because when you tear your ACL, or when I tore my ACL, I felt a pop. So that kind of threw me for a loop when it started happening, but that's normal. And now I can kind of feel, it almost feels like it needs to pop. It feels like there's a buildup in there, and then all of a sudden I'll do something and it'll have a little pop. So week 8, your graft is supposedly the weakest that it's going to be. So I made it through that. When I had gone back to the doctor, the PA told me, be careful, stay aware of your surroundings. If you're on uneven ground, or if you're somewhere where, like grass, where there could be potholes or things like that, that you might step in, be very, very careful, because any twisting of your knee is really not going to be good. So I am still very cautious and careful. Some of my activities that I'm back to being able to do, I am able to do upper body lifting, and I do a lot seated, but I am able to handle some things standing. Occasionally when I load a little bit heavier weight, I do feel a little pressure in my knee, almost like it's telling me, hey, that's a little bit too much. So if I feel that, I just am careful with what I'm carrying, or if I'm lifting that with the heavy things, I try to sit or maybe put those heavy things down. I'm back to doing yoga with one of my clients, and I'm doing fairly well in most of the poses. There are some that I still can't do, not even close. There's no pigeon, because that's a little bit of twisting in my knee. Sitting back to try to do child's pose, I still have that tightness in my knee, and I'm not able to get my butt down to my heels. So I just go to where I can and kind of use that as a stretch. I'm still very careful with anything lunging or squatting. I can squat and I can slowly get into a lunge position, but I'm very careful with those because it doesn't really feel stable enough to do that yet. So just being cautious. And that's how it's going. So pretty good so far. I must say that first month is pretty tough, mentally and physically and emotionally. And I told you I felt like I turned a corner at that first month, and now 2.5 months out, I'm feeling really positive, and I feel like I'm going to be normal one day, which in the beginning it didn't seem like that. So even though I'm not back 100%, I'm definitely better than I was. So I'm glad to report that. I'm feeling good, and I'll be back when I have something else to tell you. Bye.